sorrow. There are ways to get there if you care enough for the living. Make a little space, make a better place. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me.
Okay.
So if that bigger tube is not well opened at a particular point, which the
Right.
and earlier on when I described how we determine blood pressure in terms of the physics of it, we talked about the blood vessels and then the resistance in the vessels. Okay, so as you grow, they become stiffer. They're unable to open up very well for the blood to flow easily through it. So then the pressure mounts up. Yes, so aging is a factor.
Okay.
So with the essential hypertension, there's not like a cause of it, but then there are risk factors that predispose you to getting it. So increasing age is a factor. Now, the risk factors, we also group them into those that you can do something about, which we call modifiable, and those that you can't do anything about, which we call non-modifiable.
Yeah.
So for the non-modifiable one, increase in age and also gender.
Right.
So male gender. This has some, as you increase in age, past the menopausal years, female gender risk increases to now be more than the male gender. But in the young adulthood, usually the males have a greater risk than the females. Now, the race is also a factor, where Africans and Asians also carry a higher risk compared to the Caucasians. And then if you have a family history of hypertension, there can be some genetic and familial factors that play into it, so your risk of hypertension may be higher.
Right.
So with these ones, you can't do anything about it. If you know you have any of these, you just have to be monitoring so that you are diagnosed early when you get it. And then the ones that you can do something about are more lifestyle related.
Okay.
So we say like hypertension is a lifestyle disease also. So things like having a high blood glucose, which is called diabetes.
Okay.
Or not being able to manage your glucose in your body very well, which is diabetes. Having a high blood cholesterol, which is the fats in the blood. Okay, if it's high, you can get diabetes. Now, if you're overweight or you're obese, that is also a risk factor for hypertension. If you're somebody who doesn't physically do any form of physical activity like exercise routinely, that's a risk factor. And then if you're somebody who eats an unhealthy diet that is high in salt, that's high in refined sugars, saturated fats, that's also a risk factor.
Okay.
Now,
so the trophy and other ones. Okay.
And then also now a lot of socioeconomic factors. So they found out that people with low socioeconomic status also tend to develop hypertension. The last thing I'll talk about is psychological factors. So chronic stress, anxiety, depression, they can all feed into you developing hypertension.
Really?
Yeah.
Wow. These are things we may not have actually considered.
Yeah.
The socioeconomic factors, the fact that people from poor backgrounds are actually at an increased risk. Wow, that's amazing. So yes, we have been discussing hypertension, and Dr. Florence Akumia, a physician specialist with the National Cardiothoracic Center, just took us through some of the risk factors for developing this deadly killer, hypertension. She's spoken about the fact that with regards to causes, we can often have identifiable causes in what we call secondary hypertension, where an individual with other conditions such as hyperthyroidism, or the thyroid gland producing too much of its chemicals, what we call the thyroid hormones, or probably you having kidney issues, or probably what we call coarctation of the aorta. She's mentioned these can potentially and can often cause hypertension or high blood pressure. With regards to essential hypertension, which she mentioned forms the bulk of hypertensive cases, we don't have a single identifiable cause, but then we have risk factors, and she mentioned them, the modifiable ones, the non-modifiable ones. As we go along, we'll try and then mention them, so that if you have any of these, you try as much as possible to reduce them. Very interesting to note in her submission with regards to the risk factors. We've already spoken a lot about the lifestyle habits over and over again on ỌDADEƐ Health Matters. Each time we bring someone talking about diabetes, heart health, and everything, we've spoken about these lifestyle habits. Worthy of note in her submission is the fact that she mentioned the socioeconomic status and also psychological states such as excessive stress and depression, amongst other things. We want to go ahead.
Something else I
Okay.
want to mention, that's tobacco smoking.
Tobacco smoking.
And then excessive
Alcohol.
use,
Yes, these are very, very important, especially with most of our people being men, most of our listeners being men. It's very important. Tobacco smoking and alcohol. We'll delve deeper into that as we go along. Dr. Kumia, I would want us to go ahead. You've already mentioned, I kept hearing saying asymptomatic and all. But I want to know, are there any symptoms or signs often associated with hypertension?
So hypertension itself
Okay.
generally doesn't cause symptoms.
Okay.
But hypertension can affect various organs. We
Mm.
call it hypertension-mediated organ damage
Okay.
or target organ damage. Okay. So when it starts to affect these organs, then you can develop symptoms based on the organ being affected. But this means that the hypertension has persisted, has been uncontrolled for a long while to be enough to affect that organ.
Okay.
Or there was a sudden surge that went so high that it caused a sudden dysfunction of that organ.
Right.
Okay, so those ones will cause overseen, and that's how people end up in the emergency. So those ones, somebody can come in with a stroke, somebody can come in with difficulty breathing due to fluid accumulation in their lungs.
Okay.
That could be acute left ventricular failure.
Okay.
They can come in swollen with difficulty breathing when the whole heart is not really working well, called congestive cardiac failure.
So
They
the
can get-
heart has failed.
It's not doing it's
It's not doing its
the
work.
pump function is not as good as it is supposed to be.
Okay.
So there's backlog of fluid in the lungs and in the body. So
Okay.
it's seeping into the tissues. Your
Mm.
feet are getting swollen.
Mm.
Because it's congested in your lung, you walk a little, you get breathless, you get tired, you're unable to lie down flat,
Okay.
and all those things can start manifesting.
Yeah.
You can actually also get a heart attack.
Mm.
If you don't even get an overt attack, you can develop what we call angina, where you
Okay.
get chest pain on exertion
Mm.
due to the fact that the blood vessels have become clogged.
Okay.
And then it can affect your kidneys,
Right.
either directly on the kidney itself or the blood vessels that go to the kidney. So
Right.
eventually the kidney is not working as well as it is.
Right.
It's supposed to. Can affect your nerves. So you now get abnormal sensations or
Yeah.
numbness.
Yeah.
It can affect your eyes,
Mm.
where you have problems with your sight afterwards. So these ones, when they start coming in, then you know that there's target organ damage.
Okay.
So it's not necessarily the hypertension, but then the complication of the hypertension.
Okay. Right. So hypertension in itself, most of the time, there are no symptoms associated
Yeah,
with
we
it.
call it a silent killer.
A silent killer.
Yeah.
Okay. So until there's distraction, this hypertension leads to malfunction of the target organs, and basically with all that you're basically mentioning every organ in the body.
So because almost every organ is supplied by blood vessels, and blood vessels are affected when hypertension happens. So
hypertension
almost
affects every single organ of the body. Wow. Including the sexual organs.
Oh yes, definitely.
Okay, so this is very important. The males out there is very important. I intentionally brought this in so that if you are not listening, you're not paying attention, you probably thought, oh, hypertension, it's important that you listen now. Because hypertension can actually affect your sexual organ as well. It can affect your performance in bed. So open your ears and listen closely now. Listen keenly. If initially, you're just, let's into your moon and we'll go ahead. It's very important you listen now. Okay. All right. So these are some of the complications that can often arise as a result of hypertension. Because of how dire these complications are, I would want you to recap them. If you can go over them, probably from head to toe, so that people...
Wonderful. So for the brain,
okay,
I said it can cause stroke.
Wow.
Okay, so that stroke could be either a bleed into the brain or sudden blockade of blood flow to a particular part of the brain.
Okay.
So, and then when there's also a sudden surge, it disrupts the dynamics of the brain. So there's actually something we call encephalopathy. So that's like sort of like impairment in your brain function.
Okay.
Caused by severely high blood pressure. Then still on the head, your eyes. So we have something we call hypertensive retinopathy.
Okay.
The retina is where the images are formed. It can actually form abnormalities of the retina, which can affect your sight.
Okay.
Okay. Then when we come down to the chest, the main thing is your heart, and then the blood vessels lead into the heart.
Okay.
So like I said, it can block the blood vessels through a process we call atherosclerosis, where the vessels become clogged and narrow, so blood flow is impaired. Now, if it becomes narrow and you exert yourself and you need more blood and you don't get that blood, your heart goes into distress. The muscles of your heart go into distress, so you experience some chest pain, which may resolve when you stop exercising. So that's what we call angina. It's due to the blood vessels. Now, that blood vessels can break open and suddenly gets a clot forming that will close off that blood vessel completely. And that's when we say you have gotten a heart attack. Okay. And then, as the heart is beating, pumping, as if you go to the gym to lift weights. As you lift weights, you bulk up. So it's like the heart working hard against pressure. So it's also going to bulk up. And eventually, it's unable to either relax well or pump well. So the movement of blood is limited. And this causes stasis of blood. So you can get heart failure. Either stasis of blood. Like the blood is not... So the body tissues bring blood to the heart. It receives the blood, pumps it to the lungs. Now the lungs exchange of gases, we get oxygen. Now when it has oxygen, it goes back to the heart to be pumped around to the rest of the body. So now the heart and the lungs are communicating through this means. So if I'm unable to relax to receive the blood from the lungs, that means that the blood will back up in the lungs. And if it's backing up in the lungs, it needs to back up in the rest of the body because it comes from the body to the lungs.
So the blood is not flowing as it should.
Yes. So it will seep into the tissues and then you have effects of that. Breathlessness, getting tired easily and unable to lie flat, your feet getting swollen, your abdomen getting distended and all those things. Those are what we call signs of heart failure. Yes. And then it can affect the kidneys, and then the kidney doesn't perform its function well, and they call it kidney failure. Then I said generally, because it blocks the vessel, it can block the vessels in your lower limbs too, so you can develop ulcers or wounds that are typically non-healing. Or you can be walking and getting pain in your leg that is only relieved when you stop walking. Those are signs that the vessels in your legs may be blocked. And then it also affects the nerves. By virtue of affecting the nerves and the blood vessels, it can affect your sexual function because these are all involved in how you get stimulated. So that's how it can affect your body.
Which are the very common ones, and how common are these? How often do you see them in your practice?
So oftentimes you get the hypertensive heart disease, where either the heart has bulked up or it has become enlarged, it's unable to pump well, it's unable to relax well. So that's what you often experience. But a lot of times we see stroke, and then sometimes we see heart attacks.
I want our listeners to have an appreciation of how common these complications are. Especially with stroke and then heart attacks
and kidney
disease. I want our listeners to have an appreciation of how common these are. Typically, you work at Korle Bu Teaching Hospital, the nation's premier referral center. How often do you see a patient with stroke?
Every duty day, I think almost every duty day.
So every 4 days.
Yeah, I mean everybody does every day of the week. Almost every day of the week, there would be a stroke case, and you would also see heart failure cases coming in almost every duty. Kidney disease is like now currently the wards are almost full and it's mainly kidney disease. And we know that diabetes and hypertension are the main drivers of kidney disease now. So hypertension and these complications is very common.
Wow. So 1 out of every 5 people that you see in Ghana, one person is likely to have hypertension. Beyond that, Dr. Florence Koyo Akumia, I tried this time. She works at the National Cardiothoracic Center in Korle Bu Teaching Hospital, and she's telling us that every day that she goes to work to attend to patients, she's seeing someone with complications as a result of hypertension, be it stroke, be it heart failure, be it heart attacks, whatever it may be. And I'm sure you see heart attacks commonly because you are at the National Cardiothoracic Center. This is damning. If every single day you go to a hospital and you have, it's almost like it's commoner than malaria, because when we work together, I don't know how many malaria cases I treated in Korle Bu Teaching Hospital, but every single duty day you are seeing a patient with hypertension, complications related to hypertension. So it could be a stroke, it could be a heart attack, it could be a kidney disease, So many things. The erectile dysfunctions, I'm sure, are even more, but of course, patients would not
They're not
usually
coming to
volunteer.
the
Exactly. Wow, if you're just tuning in, this is ỌDADEƐ Health Matters. It's been a very educative and informative session so far with a very beautiful and elegant Dr. Florence Akumia, a physician specialist with the National Cardiothoracic Center. She's been educating us on high blood pressure, also known as hypertension. She's taking us through what hypertension is. I would want to recap some of the risk factors that she said can often predispose one to high blood pressure. She mentioned the fact that there are some that are non modifiable. Basically, there's nothing you can do about it. We're talking about old age, we're talking about your gender or your sex. If you are male, you're more likely and you're more predisposed to have hypertension. But as women age after menopause, they sort of level up. She's also spoken about the fact that it can sometimes run in families. And I remember one of our professors, Professor Adi, actually came up, I would not say came up, but he found out that there's a variant of hypertension that is common within Ghana. Sadly, it killed one of our eminent journalists back in the day, Mr. Komla Dumont. May his gentle soul rest in peace. I've forgotten the exact name of the hypertension variant that it is. But it mentioned the fact that we're Africans. It also increases our risk of developing hypertension. Now to the modifiable ones, the one that we can actually do something about, and for which reason we are actually here today. She's mentioned a lack of physical activity. She's mentioned overweight or obesity. She's mentioned excessive alcohol intake. She's mentioned smoking. It does not matter how many sticks you smoke. She's mentioned unhealthy eating habits, including the eating of junk food. All these are risk factors that can often predispose to hypertension. We want to go on a quick breather to acknowledge our sponsors. When we return, we'll be bringing you some more. But just before we go, you know that ỌDADEÄ Health Matters is a very interactive show. You are currently listening to us via our radio app, our Zeno FM radio app that you can get from the Google Play Store or from the Apple App Store. You're also listening to us live on Facebook at ỌDADEÄ Radio or at ỌDADEÄ Radio Ghana. We are live on YouTube as well at ỌDADEÄ Radio. You can interact with us on our Twitter and Instagram pages at ỌDADEÄ Radio. Make sure to pass a comment, give us a comment, give us your questions, your views, your suggestions, whatever it may be, and we would interact with you. If you also want to send a text to our line, our WhatsApp number is 02000 92925. I'll take the number again, 02000 92925. If you're outside Ghana, don't forget to add the country code +233 2000 92925. We'll be back. Stay with us.
The Education Standpoint is a radio program only on ỌDADEÄ Radio. The program intends to bring together all stakeholders in the education spectrum of the Presbyterian Boys Secondary School to a live studio discussion on all the topical issues in education and help put to proper perspective the views from standpoint of all stakeholders. The Education Standpoint will also help guide the school and create a better understanding for administration, students, teachers, parents, the church, and the alumni. Tune in to Education Standpoint exclusively on ỌDADEÄ Radio online, Thursdays 2 to 4 p.m. and a repeat broadcast on Saturdays at 9 a.m. I am Reverend Emmanuel Ambrose Asamoah, an ỌDADEÄ former teacher, former students, educationist, counselor, and will be your host on the Education Standpoint. Please do make a date with me.
What does the Bible say? And what sort of light does it throw on any life-related issue? John chapter 1 verse 5 states, "And the light shineth in darkness, and darkness comprehended it not." Light for Life is a Christian panel discussion program on all life-related issues and how the Bible helps us in its day-to-day application. Beloved, my name is Reverend Gordon Kwashi, and I invite you to join me and my guests on the Light for Life program on ỌDADEÄ Radio Online this and every Sunday from 6:30 p.m. to 8 p.m. I trust that as we engage in this Light for Life program, we'll all be able to say to our God, "In thy light we shall see light." God richly bless you as you tune in.
I don't know what I would do without him.
Did you know that 90% of people with autoimmune diseases will be misdiagnosed or spend years before a diagnosis is made? Precious time that could lead to organ damage. Autoimmune diseases occur when the immune system starts to attack healthy organs and cells in the body till they are destroyed. These conditions are more severe and are increasingly seen in people of African ancestry. The Rheumatology Initiative TRI is an NGO leading with education, advocacy, and research in autoimmune diseases. TRI ensures patients have the right peer support with a support group of over 200 people diagnosed with autoimmune conditions. The Rheumatology Initiative provides emergency medication for needy patients and teaches them life skills to ensure some financial stability. TRI reaches patients, health practitioners, and the general public through various educational interventions to enable prompt diagnosis and treatment for improved outcomes. How can you support our work at the Rheumatology Initiative? Please donate to our MTN Momo 024-192-9775. Account name is the Rheumatology Initiative. To volunteer, please send an email to volunteer@tryghana.org. That's TRIGhana.org. Visit our website tryghana.org to reach us, and on social media look for our handles at TryGhana.
There's a place in your heart, and I know that it is love. And this place is much brighter than tomorrow. And if you really try, you'll find there's no need to cry.
Yes, you're welcome back to ỌDADEƐ Health Matters. This is where we educate, this is where we inform, and this is where we enlighten you on all the topical health issues that are plaguing our communities, that are plaguing Ghanaians, Africans, and the world for that matter. We have been discussing hypertension in celebration of World Hypertension Day that was celebrated on the 17th of May 2020, and that will be celebrated every 17th of May, every single year. We are raising awareness and creating more awareness on this deadly killer, what Dr. Akomia Florence Koyo, a physician specialist at the Kolebu Teaching Hospital, just described as a silent killer. Very silent, because it typically does not come with any symptoms until much later, when it's already wreaked its havoc and caused all the complications she's already mentioned. Our viewers, I'm sure, may have noticed that I've changed my attire, and the reason is pretty simple. I'm actually in this white, is it a Lacoste or a polo? Yeah, it's a polo, because in Ghana, every polo is called a Lacoste. Every toothpaste is called Pepsodent, right? Yes. This white polo, as you can see, is actually the National Radiotherapy, Oncology and Nuclear Medicine Center. They are celebrating their 25 years anniversary. It's been 25 years since the National Radiotherapy, Oncology and Nuclear Medicine Center was established. This is a center of excellence that is charged with the management of various cancers. I mean, cancers in Ghana, cancers in West Africa. They treat a wide variety of cancers within the sub-region. Interestingly, the director and head of the center is actually an ỌDADEÄ, Dr. Joel Yani. Dr. Joel Yani is doing a great job there. We want to extend our felicitations to the National Radiotherapy, Oncology and Nuclear Medicine Center. You've done a great job treating and managing various cancers across the globe. God bless you so much for all that you have done. We pray that you'd continue to manage and to treat our patients with cancers and continue to grow from strength to strength, continue to grow into an international center of excellence. God bless you so much, and continue to do the good work that you have been doing these past 25 years. If you want to support the National Radiotherapy, Oncology and Nuclear Medicine Center in their fight against cancer, you can pass by. They are located at the Kolebu Teaching Hospital, and I'm sure the administration would welcome you. Yes, back to hypertension. Dr. Akomia spoke about some of the complications that can often arise as a result of hypertension. She spoke about stroke. She spoke about retinopathy, that is, issues with your vision. She's spoken about heart failure. She's spoken about heart attack. She's spoken about kidney disease. She's spoken about erectile dysfunction. Yes, erectile dysfunction. Hypertension can actually cause erectile dysfunction. She mentioned earlier that hypertension, essential hypertension for that matter, has risk factors. We want to find out how we can reduce our risk of developing hypertension. Are there any practical lifestyle measures that our listeners can adopt in order to reduce their risk of developing hypertension?
Oh yes, so that's why we call them modifiable risk factors.
Okay.
So it means that we can actually do something about it. So if we take the risk factors one after the other, for
Okay.
physical inactivity, the current recommendation is that you do at least 150 minutes per week of
Okay.
moderate intensity physical activity.
Okay.
And that's if you do 30 minutes a day, you need to do 5 days in the
Okay.
week. And moderate intensity could be jogging, brisk walking, cycling, running, swimming.
Okay.
Routinely is where you have the most impact.
Okay.
But even if you're unable to do it every day, as much as you can do, the little exercise you do is beneficial.
Right.
So we want to get 150 minutes in a week
150
physical,
minutes
yes.
in a week of moderate intensity
physical activity.
which should be aerobic, I suppose.
Yes, so sometimes we also do 2 days of weightlifting or resistance training too.
Okay.
Yes. And then for the being overweight, the main ways you tackle it is through diet and physical activity.
Okay.
So we've spoken about physical activity, but if you need it for weight loss purposes, you need to do more than what you just do for maintenance.
Okay.
Because you know that is a balance of energy. So energy input and then output is what will. So if you want to cause a deficit, you have to work out more to cause that deficit.
Right.
And then in terms of your diet, how much food you need to take in would vary based on your age and your gender and also your level of physical activity. So I always say that we eat a lot of carbohydrate dense foods with our banku and fufu and ampesi, and I think that in the past when our ancestors were mainly farmers and walking long distances as the main form of transportation, they needed that energy. But we don't need that much energy because we do not use that much energy now. So we don't need to be taking so much carbohydrates. It's our main meal with the vegetables and soups and stews rather being the side dish. But if in the West, the main meal is the protein, vegetable component, and then the side dish is the carbohydrate. So we may need to review that. But essentially, your caloric intake, which is how much energy you take in terms of food, you need about 1,800 to 2,200. Depending on your gender, males need more than females, but averagely, from 1,800 to 2,200, 2,400 should be fine.
Okay.
But this is also influenced by a level of activity. So the less activity you do, the less calories you take.
Okay.
So if you are sedentary, you don't move, you don't do anything, you need to take about 1,800 calories in a day.
Right.
Now the diet aspect, we talked about high salt diet too. So what you need to take in terms of salt in a day is a teaspoon of salt.
A teaspoon.
For the whole day. Breakfast, lunch, supper, snacks.
Not a tablespoon, a teaspoon.
A teaspoon of salt. So that's going to bring it to about 2 grams of sodium and 5 grams of salt. Salt is sodium chloride. So altogether 5 grams of salt. 2 grams of sodium only. That is what is recommended.
Basically 1 teaspoon. If you not remember the 5 grams of salt, 2 grams of sodium, remember that 1 teaspoon, not a tablespoon, 1 teaspoon of salt. A whole day.
And you realize that a lot of our foods are salted, a lot of our preservatives, I mean, like
the condiments,
have a high calorie content. Now there's a lot of fast food trend going on, so all the fries, they have high salt content. That's what we use. And it actually causes you to be addicted to it. You're always going back for more. So we generally are taking more salt than we should. Even if you say you're eating local diets, a lot of Kobe, salted mutton, momone, pig feet, and all that, they are have high salt content. So you take less of that, and then you try not to add on salt at your table when you're eating, because already that salt has gone in, and that should be enough.
It's
so
actually be above your recommended levels. Wow.
So the thing with Africans is that the type of hypertension we develop is found to be salt sensitive. So salt intake really drives hypertension in Africans. And that even influences how the hypertension of amongst Africans is treated. There are some differences in how you treat based on the race of a person. So salt is a major aspect that we all need to address. Try and reduce your salt intake. And then you should also increase your intake of vegetables, nuts, and foods that contain potassium. So that's what we call a cardioprotective diet.
And then foods that contain potassium.
Yes.
Okay.
And
then
then
cardioprotective, they protect the heart.
yes.
Okay.
And then more vegetables and fruits
Okay.
and nuts, and then less carbohydrates, less saturated fats. Yes.
Can you give us examples of some of these cardioprotective foods? I mean, within our setting, so that people can readily.
That's why I didn't particularly mention any type of diet, because there are actually specific diets that are said to be cardioprotective, like dietary approach to stopping hypertension, the DASH diet, and then there's the Mediterranean diet, because they found out that people who live along the Mediterranean Sea, they were found to be very healthy in terms of their cardiovascular health, and then they studied what foods they eat, and then they used it to develop a diet. So these are all types of diets that are said to help the heart, but generally you increase your vegetable intake. Okay, so if that forms the bulk of your plate, vegetables and a portion of fruit, and then your carbohydrate intake is decreased, so that's like a quarter of the plate, and then your protein to another quarter of the plate, and then you try and have your snacks. Maybe you can take some nuts, and then
so more like the eat well plate. Eat well plate. Okay, so you can Google that if you forget what Dr. Kumi is telling you. Can just Google it and see what the eat well plate is. But the consensus is that try as much as possible to reduce the carbohydrate, the fufu, the tuzafi, the banku. Reduce the portions. We're not saying stop altogether, especially for the elderly. You have been eating this all your life. This isn't the time we tell you to stop eating it. No, that's not what we're saying. What we are saying is that reduce the portions. So yes, you can check out the Eat Well plate that Dr. Kumia was just telling us about. Yes, we can go ahead with some of the practical lifestyle. I mean, they've been very practical so far.
So then also the processed foods. So I talked about how they are usually preserved with salt. So a lot of the processed meats too, either they have high saturated fats or they have a high sodium content. So you'd also want to reduce the processed meats and processed foods and canned foods also. So the next thing we go on to is tobacco smoking. So like you said earlier, even a stick is enough to have consequence. And tobacco smoking, I mean, can drive hypertension, it can drive narrowing of your vessels, but it can drive so many other diseases in the body. So we don't really encourage it. The youth now think shisha smoking is a better form of tobacco smoking, but that is not necessarily so, because if you smoke shisha for an hour, it's about 100 sticks of cigarettes.
Wow.
Yeah. So nicotine. Yeah, and then the cigarettes even tend to have a filter in them. So, and not all the shisha pots have the filter in them. Some people put in a filter, some don't. So you're even exposing yourself to more toxins. So tobacco smoking, you avoid it. And if you already smoke, you stop. If you don't smoke, you don't start at all. And then secondary smoking is also an issue. So you'd want to avoid environment when people are smoking, because even you inhaling the secondary smoke can have a consequence. And then with the alcohol, we don't say stop completely. We say moderation. Moderation, where we call something like 7 units a week. So if you take a shot of hard liquor, that's 1 unit.
A shot of hard liquor, that's 1 unit.
Yeah, so there are various equivalents. There's 1 glass of wine or 1 bottle of beer. There are various equivalents, but whatever it is, you don't want to take more than 7 units in a week.
Wow. 7 units. I suspect the guidelines have changed, right?
So it used to vary for male and female. Now it's both.
Which is very good, because anytime I remember back then, 14 units and all, like this is still pretty high. So 7 units. Okay.
So basically, so that's it for the smoking, alcohol use. And then if you're diagnosed with diabetes, so diabetes shares some pathways with hypertension. So when you develop diabetes, eventually along the line, you may develop hypertension. And so you have a lot of people saying, I have hypertension and diabetes. When you develop hypertension, eventually along the line, you may develop diabetes. You may also develop high cholesterol. These are called metabolic diseases. They share common pathways, and one leads to the other. And if you have more than one, your risk for what we call cardiovascular disease is compounded. So if you have been diagnosed with diabetes, high cholesterol, you have to make sure that you adhere to your treatment and it's well controlled to avoid you developing hypertension as a relating factor. If you identify that you have any psychological risk factors, depression, stress, anxiety, you need to learn how to manage them. You need to seek help where you need. You need to get adequate sleep. See a psychiatrist who may make you see a psychologist, or you may be medicated to treat your problem based on your assessment. And this will help reduce your risk also developing cardiovascular disease and hypertension. And then socioeconomic factors in there. Ghana na yeding for everybody, so it's hard to talk about, but then you should know that that's a risk factor, and then it should cause you to be checking your blood pressure
more frequently. Yes, I want to dwell a bit more on this alcohol. I mean, you mentioned the fact that 7 units of alcohol in a week. 7 units of alcohol in a week. Majority of our listeners are actually men who engage in drinking, social drinking. I would have to admit, others have actually made it more of a habit. It's turned into abuse of alcohol. 7 units in a week. Can you elucidate more on the units? I think you mentioned that a shot of hard liquor. We are talking about hypertension. We're talking about gin. That is 1 unit.
That's 1 unit.
So we are looking at taking about a shot of each
a
day for 7 days. That should be okay.
And then the issue about binge drinking too. Binge drinking can actually also have consequence. So we don't also encourage binge drinking. A lot of people say, I drink once in a while, and once in a while they're going to drink into stupor. Like drink and get drunk, fall into gutters. That's also not good. So that's a problem too. So a glass of wine, and you see there are various, that's why I didn't want to go into it, because somebody's gonna be like a glass of wine and take it. There was this meme that went around, a huge glass of wine,
more like a jug.
So it depends. I think that's 125 mils for the wine glass. That's 1 unit also. For beer, I think is a small bottle of beer that's equivalent to a unit. So it depends on what liquor you're taking and how it's produced.
All right, that is it regarding alcohol. For those who are mathematically inclined, I actually remember you teaching me this about how to calculate the units of alcohol that you are consuming. So those who are mathematically inclined, those who would often take a look at their bottle before they drink. I don't drink, so I don't know. But I'm sure quite a number of people would often look at it before they drink. There's often a percentage written, a percent of alcohol. So if you want to find out the number of units you are drinking, you just multiply that percentage by the volume, that is the quantity in liters. And then it will give you the unit. That's actually something that Akumia taught me somewhere in 2020. So yes, if you are mathematically inclined and you want to, take alcohol in moderation, you care about your alcohol intake, it is one of the ways to do it. And we are advising, the World Health Organization is advising and encouraging that we take at most 7 units of alcohol within a week. Dr. Kumi has also mentioned and stressed on the fact that binge drinking is also a no-no. So the fact that you are drinking occasionally, but you are drinking to stupor, further puts you at risk of developing hypertension. And
even as an added factor, the alcohol has a whole lot of calories. So people, they call something a beer belly. So if you take alcohol in excess too, you're going to develop central obesity. And that in itself is even a risk factor for developing diabetes and cholesterol abnormalities, which are linked with hypertension.
Central obesity. What exactly is that?
So where the fat deposits in your body can vary. And through studies, they found that if your fat deposits in your abdomen, then we call it's in the center of your body. That's what we call central obesity. So if you are getting a pot belly, and I don't remember offhead, but then there's a girth, abdominal girth, that varies for male and female. So there are set points. If you exceed that, then you have central obesity, and it's one of the metabolic risk factors.
So you've mentioned that these are they are interlinked: diabetes, obesity, central obesity for that matter, hypertension. These are sort of interlinked. And you also mentioned high cholesterol levels. All these come to play and either lead to the other or become complications of the other. Okay, so if you're just tuning in, this is ỌDADEƐ Health Matters. This is where we educate, this is where we inform, and this is where we enlighten you on everything health. And Dr. Florence Koyo Akumia, a physician specialist with the National Cardiothoracic Center at Korle Teaching Hospital, has been educating us on hypertension, some of the risk factors, what we can do to reduce our risk. That is just what she described to us. She gave us very practical measures. It wasn't the usual exercise, don't take too much salt, don't take too much sugar. She has actually given us practical measures. She said that 150 minutes of moderate intensity aerobic activity in a week should be good for you. So we're looking at 30 minutes of brisk walking, jogging, cycling, whatever it may be, for 5 days, and that will give you 150 minutes, right? Okay. Or what else you could also do? We are talking about reducing your salt and your sugar intake. We say your salt intake to 1 teaspoon of salt in a day. Already some of the food that you eat contain, your condiments and your spices, they contain way more than the 1 teaspoon of salt. So it is very imperative that you also reduce what you add to your food, even as you prepare it. We're speaking about sugar. I don't think we're speaking about sugar.
Yeah,
How
so I
important is
didn't
sugar?
talk about sugar because I talked about calories.
Okay.
Yeah, so
Okay.
that's why I can determine how much sugar a person should take. I mean, if you are diabetic, you wouldn't want to take foods that have what we call a high glycemic index,
Okay.
or you'd want to balance it out.
Okay.
Yeah, so that's why I spoke about it in terms of calories, because in the end they all add up to the calories you take in a day.
Yeah.
So
Okay. If I remember right, I think the World Health Organization, their recommendation in regards to sugar in terms of teaspoons, also 6 teaspoons, I think, for females, and then 9 teaspoons for males. Regardless, it's actually advisable you reduce your 6 teaspoons, even if you are a male, because, like Dr. Kumi has already said, most of the foods that we eat, the processed foods, they usually contain, imagine Coke. Coke already contains more than 6 teaspoons of sugar, so as much as possible. The point is to reduce your intake of salt, reduce your intake of sugar, reduce your intake of processed foods. Try to eat the vegetables and the fruits, increase the intake of those ones, reduce the amount of calories, get physically active, stop smoking, reduce your alcohol intake to just 7 units. And you would be on your way to reducing your risk of developing hypertension, to reducing your risk of developing diabetes, so that you can enjoy a healthy, happy, long life. Like I told you before, ỌDADEƐ Health Matters, we want to hear your questions, we want to hear your suggestions, your views. So you can send your questions. We'll be going to our listeners very soon to take your questions and then hear from the expert in our studios, Dr. Florence Akumia. She will be answering your questions. So send them to our WhatsApp number 02000 92925. I'll take the number again, 02000 92925. And if you're outside Ghana, probably in Barcelona, Spain, don't forget to add the country code +233 2000 92925. Dr. Kumia, which team do you support?
Manchester United.
Oh, Manchester United. Sadly, it wasn't a good day for you yesterday.
I really don't follow football. But then
Okay. Is there a reason you support Manchester United?
my dad supports.
Oh, okay. Yeah, that is typically it for most ladies. One of our daddies, currently an anesthesiologist at Korle Teaching Hospital, trying to remember the name, it escapes me now, a very staunch supporter of Manchester United. Let's get back to hypertension, right? We've spoken about the complications. We've already spoken about ways to reduce our risk of developing hypertension. Now, how about the individuals who are listening to us who've already developed hypertension? You've mentioned complications like stroke. Someone is probably out there and his heart is beating. I don't want to get stroke. I don't want to get heart attack. I don't want to get heart failure. What can I do to reduce my risk of developing these complications?
Okay, so these things that we discussed as ways to prevent developing hypertension, they all form part of the non-pharmacological treatment of hypertension.
Okay.
So they still will form the basis of treatment of hypertension if you have hypertension.
Okay.
You will still be asked to comply with all these lifestyle changes. Okay. Now, if you may also be required to take medications.
Okay.
And these medications, there are various groups of medications. How we described how blood pressure comes about. So they address different aspects of blood pressure.
Okay.
Some of them will cause the blood vessels to relax better. Some of them will decrease how fast the heart is beating. Some of them, so all of them will have a way in which they would help reduce the blood pressure.
Okay.
So based on your characteristics in terms of maybe your race, if you're black or if you're Caucasian, in terms of maybe whether you've already developed complications like heart failure, or you already have kidney impairment. All these will be taken into consideration to determine which drug would best work for you.
Okay.
Now, sometimes they may start with one medication, but over the years, we've come to find that usually one medication is not enough. So sometimes you'd require 2 medications. So their guidelines are now going that you start with combination therapy.
Okay.
And to help everybody take the medication and not feel like I'm just pumping myself with pills, we even have found ways of combining them into one pill.
Right.
So you're taking one pill but it's 2 medications.
Right.
The benefit here is that you are addressing more than one pathway of the hypertension, so your control is likely to be better, and people don't feel overwhelmed by the pill burden, so then they tend to comply with their medications.
Right.
This is not a medicine class, so I don't want to talk about all the classes of medication.
Okay.
But commonly for blacks, you may be put on a calcium channel blocker. Drugs like nifedipine, amlodipine. You may also be put on a thiazide-like diuretic or a thiazide diuretic. So like for the thiazide, like in dopamine. For the thiazide, you have hydrochlorothiazide, benzoflumethiazide. So those ones are there. Sometimes you may be put on what we call an ACE inhibitor, an ARB, angiotensin converting enzyme inhibitor, or the angiotensin receptor blocker.
Right.
So these ones also have a way in which they act to help reduce the blood pressure.
Right.
As you are going on, they titrate your treatment based on how your blood pressure is controlled. So you may be asked to measure your blood pressure at home, and based on how it is, either the dose will be increased or another medication will be added on. It also may be based on whether you develop side effects to any of the medication. So this is why you would need to continuously follow up with your doctor. There will always be a schedule. Even if you are so well controlled that you're not going very often, they will check on you at least once a month or every 6 months. It's good to go because complications may develop at any time, and the earlier you detect that complication, the earlier you can intervene and prevent it from progressing. So this is how you'd usually go. Your doctor will assess you, advise you on these lifestyle changes. If you require medications, start you on medications, monitor you for side effects, monitor you for treatment efficacy, and then if you are well controlled, you end there. If you are not well controlled, they titrate the dose or add on something else for you.
Right. So these are actually some of the ways to reduce one's risk of developing complications if one already has hypertension. So one, you mentioned the fact that the lifestyle changes or the lifestyle habits that we early on mentioned are key. They form the foundation, and you still have to stick to them regardless. And then 2, you've spoken about pharmacological, using drugs to treat this hypertension and the importance of sticking to the regimen. And then 3, you mentioned measuring the blood pressure. I want you to hammer on that again. You spoke about, checking the blood pressure and then seeing your doctor with it and all. How important is this?
Okay, so we found out that in the hospital environment, sometimes when you check the blood pressure in the hospital environment, the blood pressure may be a bit higher than it actually is.
Right.
We have what we call the white coat hypertension, where sometimes based on anxiety and other factors, persons have their blood pressures going high when the blood pressure is being checked by a health professional or in a health facility. So we actually, for a more objective reading or assessment of your blood pressure, we may ask you to check your blood pressure at home.
Right.
So you need to get your own device at home. A lot of people do not want to buy, but it's a good way for you to participate in your healthcare. And then it makes you more responsible, because if you check your blood pressure and it's persistently high, and you are aware that this is because I'm not taking my medication, you'll be moved to take your medication.
Right.
So you check your blood pressure at home. Okay, so this year's theme was checking the blood pressure accurately. So 30 minutes to check your blood pressure. You wouldn't do any strenuous physical activity. You wouldn't smoke. You wouldn't drink caffeinated drinks. You would empty your bladder.
Okay.
Come and sit down, relax for a while, and you check your blood pressure.
Okay. Sorry, you are taking us through the right way to measure our blood pressures accurately now, right?
Yes.
Okay.
So
can you start over again so that our listeners, if you had probably lost track of the discussion, Dr. Komia is taking us through how we can measure our blood pressures accurately ourselves, or even for the health practitioners, for the medical counter assistants. I mean, they actually play a key role in the diagnosis of hypertension lately, because many people often go to pharmacies to have their blood pressure checked. It's very important, it's imperative that you listen closely as to how we can measure our blood pressures accurately in order to be able to diagnose and then control hypertension. Can you please take it all the way?
Yes, so to check your blood pressure accurately,
okay,
usually we want you to be in a calm environment or setting. We also don't want you to be under any form of stress. So you also wouldn't want you to take any caffeinated drink.
Okay.
You wouldn't smoke at least 30 minutes before the blood pressure is checked.
Right.
And then you'd also empty your bladder, because it's been found that if you have a full bladder, you can have some, you may be a bit anxious, you want to use the washroom.
But not a urinary bladder.
Yes,
so
we're talking about
urinate.
So empty your bladder, urinate, be free.
Okay.
Sit down, you've walked to the place, you walked around, sit down, relax for a while, and check your blood pressure. Usually with the first blood pressure you measure, you'd usually discard that.
Okay.
You check it twice after that, each 1 minute apart, and then you take the average of, so you've checked 3 times.
Okay.
You now take the average of the last 2, and then that would be your blood pressure for that setting. If your doctor asks you to check, and then when you are checking the blood pressure, you should be seated,
right,
with your with your back supported, your arm supported.
Right.
A lot of people ask, which arm should we use? So usually when you first go to the doctor, they'll check both arms, and then the one that has the higher blood pressure, because there's some slight variation. So the one that has the higher blood pressure will now be your reference arm. That's what you use to check your blood pressure moving forward.
Right.
So you relax with the blood pressure monitoring device at the same level of your heart. Then you check your blood pressure. Check 3 times, discard the first one, average of the last 2. That's your blood pressure for that day. For that setting.
Right.
Yes, and then usually if the doctor tells you to check at home, they may tell you to do it twice a day, morning and evening, for at least 4 to 7 days. But sometimes they may let you check for 2 weeks so that we see the trend, and then we're able to use it to make any decision concerning whether you need to start treatment or whether you need optimization of your treatment or any form of adjustment in your treatment.
Right. Right. I've seen somewhere about one not crossing the legs. How important is
this?
Yes,
so your legs should be flat.
Okay.
On the surface.
Okay. All right. We're talking about measuring blood pressure accurately, and this actually came while we're talking about people who already have hypertension, checking at home and bringing the profile to the doctor. How about individuals? There's someone listening to me now, very young, does not have hypertension, is not bothered. Why do I have to check my blood pressure? Are these people also included? And how often should they check their blood pressure? So
every adult, which technically is 18 years and above, should have their blood pressure checked. Now, if you check your blood pressure and it's less than 120/80, you can check every 5 years. So if
every 5 years?
Yes. If it is between 120 to 130, and then 80 to 85, you can check every 3 years.
Okay.
Now, if it is above that, closer, that's in the pre-hypertensive range, you may actually be asked to do what we call the ambulatory BP monitoring.
Okay.
The home BP monitoring that we have just described, that you'll be checking at home twice a day to see whether you actually have hypertension, but just that in that setting, it seemed to be normal, which we call maxed hypertension.
Okay.
So you'd be asked to do that, and if that shows that, you really don't have hypertension yet, but your risk for hypertension seems to be higher, you check at shorter intervals. So you need to check at least these intervals I've given, or at any opportunity you get.
Right. Yes. Right. And looking at the fact that our health-seeking behaviors are not so good, and I know you're someone who deals with a lot of guidelines. I mean, telling us about how often you check your blood pressure when it's less than 120/80 and all that. People would tend to forget. Take into consideration how terrible our health-seeking behavior is, how often would you recommend the average adult without hypertension to check their blood pressure?
At least
without
once
any
a year.
guidelines?
At least once a year, because you're supposed to have an annual wellness evaluation.
Okay.
So when you go for your wellness evaluation, they will check your blood pressure.
Okay.
So at least once a year.
Once a year
fine.
if you don't have hypertension. But if you have hypertension, then you may need to check it even more often.
Yes.
Okay, so that has been it from Dr. Florence Akumia, telling us about the ways to accurately measure our blood pressures. If it is high, control it so that we can live a healthy and a long life. I have a couple of questions actually, but she seems to have actually tackled all of these ones. So we'll go straight to some of the questions that we have received from our listeners. This is coming from Yao Asabre. Yao Asabre says that this is a very educative session. Thank you very much, Dr. Akomia, for educating us this afternoon. I have questions with regards to antihypertensives. You mentioned some side effects. What are some of the side effects that antihypertensives can often cause, and what should we do about them?
So the side effects, I mentioned that there are various types of antihypertensives, so they may vary from type to type.
Okay.
So some of them that we commonly use are the calcium channel blockers that I talked about.
Okay.
Those ones can cause headaches.
Okay.
They can cause swelling of your feet.
Right.
Yes. Sometimes some people even develop palpitations or fast beating hearts when they are on it. So those ones are known side effects. So your doctor may alert you of the possibility. Even if they fail to alert you and you develop anything like this, you should see them and then they'll address it.
Okay.
Sometimes when you start an antihypertensive, your blood pressure can drop precipitously.
Okay.
And that can cause you to feel lightheaded.
Okay.
So that's also something that can happen, especially with the ACE inhibitors and then also the thiazide-like diuretics, because they affect your urine production. So you can lose some electrolytes in your urine, so some electrolyte abnormalities may set in. So it varies from what drug you're put on, and this is one thing that the combination pills are made to address, so that when you do them in combination, you reduce the side effects that you have from going to very high doses of one. And then sometimes the side effects will cancel each other out. If you combine a thiazide-like diuretic with a calcium channel blocker, and the person is getting swelling of the feet, then diuretic will reduce that swelling by causing you to pee a lot.
Right. So the take-home message is that you can develop side effects to antihypertensives. We are being truthful about it, but they can also be addressed because the classes of drugs differ.
They differ.
We can always change it for you.
If you tell your doctor, we can change it for you.
Okay.
Sometimes we would. It will be based on, some of them pass with time.
Right.
Some of them persist.
Right.
So sometimes we may monitor, but if it persists, an alternative will be given.
So if you are listening, yes, side effects can often arise as a result of taking some antihypertensives, headache, swelling of the feet. I've actually heard some men complain about erectile dysfunction as well. And you see, we are very honest with you. I'm telling you that this is the truth of the matter. This is what can happen as a result of you taking antihypertensives. But when they do happen, please come and see us, and we would address them. We'll address the side effects that you're having, and if there's the need, we'll change the medications for you, because there's a vast array.
So let's talk about the erectile dysfunction a lot, because it's a lot of young men come and they were diagnosed a few years before, but they didn't take their medication. And that's because they heard that it causes erectile dysfunction.
Right.
So there's a potential to cause erectile dysfunction. Not everybody will develop that erectile dysfunction.
Certainly.
And if you develop erectile dysfunction from the drug and you inform your doctor, either a change will be done or another medication will be given to counter that effect.
Right.
If you do not treat your hypertension, you may develop erectile dysfunction from the hypertension's complications, and you may develop all these other complications.
Right.
So if you weigh the risks and the benefits, it's better to take your treatment than to not take it because of a perceived risk of erectile dysfunction.
Right. This is very important to note. Take your antihypertensives, and if you have a side effect of erectile dysfunction, we can always change that. We can always correct that erectile dysfunction. Don't take your antihypertensives and your hypertension will invariably lead to erectile dysfunction. Most likely, the chances you are going to develop erectile dysfunction from hypertension is way higher than the chance of you developing erectile dysfunction from taking an antihypertensive. And it's actually one particular class that would often lead to this side effect. there's a host of other classes that we can always change you to. So yes, don't let the fear of erectile dysfunction. I know how important this is to men. A man would rather die than lose that ability to perform in bed. I know how important this is to you. Doctors, we are well aware of it. There are males amongst us, there are females amongst us, and both genders understand what this means to you. And that's why we are telling you that yes, a side effect can arise, but we are willing and we'll be there with you to address it so that you can go back to your former self, your former Hercules self, right? Okay. Okay, let's go ahead with some of the questions. This one says that I was diagnosed with hypertension about 10 years ago, and I've actually been on my medication. I've noticed that my blood pressure is normal. Can I stop my medication now?
Okay, so what happens is that hypertension is a chronic disease.
Excellent.
This means that the mechanisms your body had to control your blood pressure have been offset, so you are likely to have a high blood pressure.
Right.
The medication is not a cure. It is to control the blood pressure to keep it within normal limits, because when it's above the normal limits, you have complications like we've discussed.
Right.
So the medications do not necessarily lead to a cure. The medications, when you take them, after a time, build up in your system so they can last for a duration.
Right.
So if you stop a day or two and you check your blood pressure and your blood pressure appears to be normal, it may be due to residual effects of the medication. And most likely you stop checking and say, oh, my blood pressure is normal now.
Right.
But there's going to be a day everything reverses, it goes, and then it can just shoot up. And then you're going to come in with a stroke. And it will be too late at that point.
Right.
So it's better to take your medication. If it's well within normal limits, that's what we want. And that's due to the medication. If as you're growing or circumstances change, the blood pressure is dropping below some parameters, you inform your doctor. Your doses may be adjusted.
Right.
There are some rare occasions where the blood pressure becomes so well controlled that you now just be on lifestyle modification. But that is not a unilateral decision to make. You should inform your doctor so that they will now consider all factors involved and know whether it is safe for your medication dose to be reduced or for it to be withdrawn. But most likely, you'll be on the treatment lifelong.
Right. So hypertension is not curable. We don't cure hypertension
except the secondary causes.
Except the secondary causes, yeah. But the majority,
the primary hypertension,
essential, we can't cure it. So it's basically you have to be on your medication. You have to adhere to the prescription that has been given you for life, basically, until the doctor assesses you and decides that, looking at what your blood pressure is now, and probably if you're having side effects of low blood pressure, that is when they can decide to stop it. So this is not a decision you, the patient, take on your own, if I'm getting you right.
Yeah.
Okay. So the doctor started the medication. The doctor should be the one. We're not being autocratic, but it would make sense. The doctor took the decision together with you to start the medication. It is only right that in stopping that medication, you speak to your doctor and then you both decide based on the circumstances to either stop or reduce the dosage. Okay, on to our next question. This one says that thank you very much, Dr. Kumia, for the enlightenment this afternoon. I've gotten to understand hypertension much better, and the lifestyle measures are very practical. Thank you once again. I heard you talk about exercise, and you mentioned that we can exercise for 50 minutes. You mentioned that we can exercise for 150 minutes in a week. Does this apply to every age group? Because I'm currently a 70-year-old with brittle bones. Does this exercise apply to all age groups?
There's no age limits that I have seen so far. But I mean, definitely is based on your functional capacity or how much exercise you can do.
Right.
And there are various forms of exercises. So if you don't necessarily need to go and jump rope or cycle, but there are various forms of exercises that you can do.
Right.
So if you don't necessarily, you cannot brisk walk, but you can walk at a leisurely rate. You just do that for a longer period and you still get the benefits of exercise.
So you have your question answered. You don't necessarily have to be a footballer or to be a long distance runner or anything like that. Just walking, being active. Don't be sedentary. Don't sit at one place for way too long. That is the crux of the message. Now, our very last question, I know a lot of it is coming in, but unfortunately we are running out of time, and we'll have to give Dr. Kumia some time to go back to saving lives at the National Cardiothoracic Center. This one has to do with the alcohol intake. It's asking, how about wine? I've heard that wine is good for the heart. How true is this? Is there any scientific evidence to back it? This is coming from red wine. Our people who love wine, red wine. Yeah.
So yes, there's a part of grapes.
Okay.
That most wine is produced from grapes. A lot of red wine is produced from grapes.
Right.
So there's a part of it. I think it's resveratrol or something like that.
Wow.
Which has been found to be.
Wolo.
It has been found to have a cardioprotective role.
Okay.
So that's why people were like, red wine is safe, red wine is healthy for the heart. But it all boils down to how much of it you take.
Okay.
That's why we still adhere to the units per week, right?
Okay. All right. So
a glass of wine a day won't hurt. Yeah.
Okay. All right. So yes, red wine, there's a bit of it that is protective, that can provide some benefits to the heart. But moderation is still the key word. Moderation is still the buzz word. To our penultimate question, this is not coming from anyone, but it's something that we often tend to do here at ỌDADEƐ Health Matters. It's not enough that we talk about what the patients can do. We want to find out what we healthcare practitioners can do, what civil society can do, what individuals within the society can do. You are a member of the Ghana Society of Cardiology, right? And also the vice president of the Ghana Association of Doctors in Residency. What role do you think civil society, government, non-profit organizations, what role do you think we should play towards this fight against the silent killer that is hypertension?
So I think when you talk about prevention, there are various levels of it, from primordial to primary. Yeah. So the government and the legislative body could, make laws that restricts imports of certain unhealthy foods, processed foods.
Right.
They could increase taxation on these foods.
Right.
They could rather give subsidies to the healthier options. Improve agriculture so that we have these vegetables readily available and affordable for everybody to get.
Right.
And then for the corporate bodies, in industrial areas or corporate areas, you should try and have means by which your workers who come very early and leave late can still have a way to exercise.
Right.
So some places it is mandatory that the facility or the building that has this number of people should have a gym in there, so that maybe their break time people go and work out. The government can also make laws, safe cycling lanes, so that people can use bicycles as opposed to driving cars. When it comes to society, the Ghanaian Society of Cardiology did a good job this year. So the May Measurements Month has been something that has been done globally. So every month of May, we try to raise awareness about hypertension and get people to measure their blood pressure. So this year, we went out of the way to educate a lot of people. We had screening exercises. So that's what some organizations can take it upon themselves to do. For health professionals, the goal is to educate every opportunity you get. Your church, your friend group, your old boys association, old girls association, every opportunity that you get, because the more people know about it, the more they can do to prevent it. So we hope that through education we can get more people checking their blood pressures, so that we get actual data for Ghana, so that we can work with the data that you imagine. You go to government, okay, do this, how many people actually need it, and you don't know the real numbers. So that's one thing that we can do.
Educate the people. The more they are empowered, the more likely they are to do something about it. Those are the words coming from Dr. Florence Akumia, a physician specialist and a fellow in cardiology, with a master's in cardiovascular preventive medicine, who will be educating us on hypertension this beautiful Wednesday afternoon. You are involved, I am involved, everyone is involved. Let us all get involved. And in that vein, I have a non-profit organization known as Office On Field Lifesavers. We've taken it upon ourselves to empower and to advocate for health, and mainly has to do with non-communicable diseases, where we go out there usually to trotro stations, to market women, or to just any place, churches, where people would often gather on a regular basis. What we do is that we educate them on what is hypertension. We donate a sphygmomanometer and leave it with them, teach them how to measure their blood pressures accurately so that they do it themselves, they record it, and then the doctor stays in touch. Every month we go back, find out how many people have hypertension, and then it's something we are trying to do. I want to encourage all the members of this non-profit organization. Thank you so much for supporting me and for helping us run this program. God bless you so much. And like you said, the Ghana Society of Cardiology has been doing a great job educating. They've carried out what called the May month of measurement, right? Yeah, where they've gone out there to check blood pressures of various individuals. She mentioned very important points with regards to organizations have places where people can work out during their breaks. Try and then give them. I know the socioeconomic status is currently there, but it's also important that they give them enough time to also rest so that they can be healthy. A healthy workforce, a happy workforce will lead to more productivity. We have been in the studios with Dr. Florence Akumia, educating us on hypertension, high blood pressure, and what we can do to control it and reduce the burden that is had on our population. Before we go to what we would want you to tell our students that may be listening to us, what are your final words regarding hypertension? Is there anything you want to say about hypertension before we go ahead?
Yeah, so hypertension is common.
Okay.
Even in Ghana, a lot of people have it. Whether you are in the village, you are in the city, you may get hypertension, especially if you are increasing in age. You wouldn't know until you check your blood pressure or until you develop a complication. So check your blood pressure at every opportunity you get. If you are diagnosed with hypertension, comply with the lifestyle changes and with any medications that you're given so that your blood pressure can be controlled to prevent all the complications. This is my take-home message for you all.
The take-home message is pretty simple but heavily loaded, that if you follow, would lead to you reducing your risk of hypertension. And if you already have hypertension, would reduce the risk of you developing complications. I know how smart you are. You're part of the umbrella team in Wesley Girls. Beyond Wesley Girls, I met you in while we were both practicing. I worked under you. Someone told me that this lady should know ECG rough. Everyone knows how smart you are. You are also someone who seems to have a holistic grasp on your life. I mean, it's not just about medicine for you. You do other things. What message do you have for our boys out there, the young ỌDADEƐs currently in school who might be listening to us? What message do you have for them?
Generally, I think back when we were in school, we didn't have a lot of people coming back to tell us about the options out there.
Okay.
Our goals were a bit skewed. We sometimes were very narrow-minded in our decision making. You need to focus on your education.
Right.
Once you have good educational background, you can branch into any field within reason, of course. So you need to focus on your education and get the grades that are required. Every other thing then becomes capable. Once you have your foot in there, every other thing is possible. So do the best you can. I mean, for boys' school, I hear you don't have teachers teaching you all the time. So, but take your books seriously.
Right.
Pass your examination. Think critically about the direction you want your life to take. Be holistic when you think about it.
Right.
Pursue the academics, but pursue the money too, because money makes the world go around.
Right.
And don't forget God. I mean, if you're Christian or whatever religion, I mean, have some focus in terms of your spirituality,
Right.
and everything would be fine.
And everything will be fine. Focus on education. Don't forget God. Work hard. Be holistic. Those are some of the words that came out from our resource person, the very elegant and beautiful Dr. Florence Koyo. Did I get it right? Koyo.
You get there.
Akumia, who is a physician specialist. She's actually a physician specialist with the National Cardiothoracic Center, the premier center for the diagnosis, management, and treatment of various forms of cardiovascular ailments in Ghana, in West Africa, in Africa, and the world for that matter. we want to say a very big thank you for coming. I know how difficult it is to leave work, make time, and then be here with us. We are really grateful. God bless you.
Thank you for having me.
And what do you think? Would you want to come back to our studio again? What do you think about our studio?
I think it's a good initiative. It's a nice setup you have here. I wouldn't mind coming back.
Right. We'll definitely get you back. Would you want Wesley Girls to have something similar?
Oh, yes, definitely.
Okay,
I'm sure we have something in the works.
Okay, all right. So Wesley Girls, you can take a leaf or actually more from our book, okay? Try and then... This is coming from an old student. He said, look, copy. There's no harm in copying, okay? Mr. ƆdADEƐ is also an old student of St. Augustine's College. He's also saying that, yes, this is a beautiful studio. So, St. Augustine's, please raise body, okay? Also try and then set up something like this so that the students can also, be holistic, like Dr. Kumia's well-spoken. All too soon, we'll have to draw the curtains on yet another exciting edition of ɔDADEƐ Health Matters. This wouldn't have been possible without the support of ɔDADEƐ Medical Guild, ɔDADEƐ 81 Group. We say thank you so much for setting up this studio. To our executive producers, Mr. Eddie Kofi, aka Edifico, Mr. Johnny Adufending, aka Zonda, my boss, Mr. Dr. ɔDADEƐ, Dr. Prince Samuel Nyoma, and also from Dr. Kumia, resource person today. We want to say a very big thank you to our fair-haired listeners. This wouldn't have been possible without you tuning in. Stick and stay with us. We have a lot more on ɔDADEƐ Radio that would be showing shortly. Have a lovely week. Bye-bye.
There's a place in your heart, and I know that it is love.